This is Valerie Van Boeven with the Senior Care Industry NetCast, where leaders with 3 or more years in the senior care industry get to share their advice. It's 6 questions, or maybe 7, in 9 minutes, so let's get to it. All right, in a few sentences, tell us who you are and what you do.
Well, thanks for having me. I am Daniel Levy. I own and run Advantage Private Home Care here in Atlanta, Georgia. I'm a person who at the age of 20 was introduced to this industry. I had a bad accident and it set me to a career path and passion to serve others for the rest of my career.
Nice. So glad that you chose this career because we need lots of folks helping everyone from adults to seniors. So we're in the middle of, or hopefully we're kind of still in the middle of this COVID crisis, but hopefully we're seeing some light at the end of the tunnel. How have your families caring for or setting up care for seniors been affected by the COVID crisis?
Well, a lot of precautions. You know, there's been huge anxiety that is built between families and senior facilities and industries like ours. So I think taking the right precautions have really changed things as far as making sure that the caregivers are definitely following the proper protocols for PPE, for example, making sure that the families are actually in a safe environment too, and just really having a lot more in-depth discussions about how to set that up.
Yeah, absolutely. And that leads to our next question is, how would you advise families who currently have loved ones in nursing homes or assisted living facilities?
Well, I think that one, the senior facilities have definitely done the best job they possibly can, and it's such a hard situation. You really have to know the facility that your loved one's in, and then we've seen a little bit of everything. We have had patients that have joined a home care service for the interim time, where they have taken their loved one out of the facility just for a month or two, and they've done some home care services. Or in some situations, we've actually even been able to send our caregivers into the facility to give them a little extra one-on-one assistance, since they're limiting family interaction.
That's true. Yeah, lots of limitations. So that's really nice. So how does home care differ from long-term care facilities in the delivery of care?
So I think the biggest difference is really one-on-one care, continuous hourly. So we send caregivers into the home usually for multiple hours at a time. Some families get around-the-clock care, and some families just get 6 hours a day, a few times a week. So really in the home environment, you have the opportunity to really control who's coming in and out. So when they schedule with us, for example, we really focus on having one caregiver, and that caregiver, be limited to that family. So that's one example of that.
Yeah. That one-on-one care really helps. And we've seen so many nursing assistants and CNAs and caregivers really take this so seriously that they are limiting their exposure to others in order to be able to work and not make their seniors sick. All right, so what precautions, I just mentioned one, are you taking for your certified nursing assistants and the seniors in your care?
Yeah, so, as time has gone on, every day we have been focusing on the right precautions, not only for our staff, but even for the families. We've had to talk with the families about their limitations and their exposure compared to our caregivers as well. So for us, we've been very fortunate and blessed that we have had PPE, which is the proper equipment and attire, and we've made it mandatory for our staff. So, that includes things like face shields, masks, gloves, of course, hand sanitizer, and then obviously the certain protocols of making sure if they, of course, have any symptoms whatsoever, that they are notifying us as a company, and we are making those proper, precautions to make sure they're not going into that environment.
Yeah, I think that's so important. Staying up. Will there be an edit right there? Maddie? All right, I'll edit that. I'll edit little dogs bark out there. Okay, you ready? Here we go. Are Advantage Private Healthcare's clients seen by a doctor or nurse, and can they receive PT, physical therapy, and occupational therapists at home?
Yeah, so what we do is our company focuses on the private one-on-one care, but a lot of people don't know that in your home environment, you can still have physicians that come or do virtual calls. We also work with home health and hospice companies, and they're a provider that actually focuses with registered nurses, physical therapists, occupational therapists, speech therapy. So again, there are a lot of different things that you can add to a service like Advantage Private Home Care where you're able to get that type of focus outside with us as well.
That's awesome. Having a one-stop shop is really helpful, especially right now. So how do you match clients up with the perfect certified nursing assistant caregiver for them?
Well, I appreciate you asking that. I think that's really one of our favorite things to do. I think when you're looking at a company that you need to go with, experience is part of it. You know, we've had the Advantage Private Home Care has been around for 15 years. I've been in the industry for 20. I think knowing your staff, first of all, is very important. So for companies like us, they're W-2 employees. They are all certified nursing assistants with our company. So that's one side of it, but really getting to know the family and what their needs are and interviewing that family. So if you're talking to a daughter or a son or a loved one, really asking the right questions about what type of personality is the client that we're going to take care of. What do they want? What are their needs? And again, we've been blessed to have the experience to typically get it right. And we always tell families, if we send somebody and they're not a right fit, then simply just let us know and we'll make sure we do that. Another thing we do is also sometimes we're able to set up a meet and greet, and they're able to meet that caregiver ahead of time, and we make some of those decisions before we start.
That's great. It's so important that people feel compatible with the person that's going to be around them all the time, you know, or at least a few hours a day, often more than even a family member might be. So that's awesome that you guys go to those lengths to make sure it's a good fit. Well, Daniel, thank you so much for being on the show and for answering these questions. You know, the current crisis that we're in, a lot of folks have those questions about, well, what does home care do? And we see a lot of positive news about more folks and understanding the value of home care in a situation like this. So you don't have to be afraid. You just need to work with the right company with a lot of experience. So thank you.
We appreciate it. Thank you so much for having me.
Thank you, Daniel.